in the test lab.
My name is Christopher Schlachta. I'm a professor of surgery at the Schulich School of Medicine and Dentistry, and I'm also the medical director of CSTAR, which is Canadian Surgical Technologies and Advanced Robotics. CSTAR is very much what I would consider to be an innovation center. And when we talk about innovation, we think about the full cycle from not just invention, but also to ensuring that whatever new idea, new surgical procedure, for example, you have finds its way into everyday common usage. You want to get those new ideas actually into frontline patient care. So we approach that need from several angles. So we certainly have a number of committed innovative surgeons who are constantly pushing the frontier of computer-assisted surgery. We think particularly of minimally invasive surgery. We're always looking at ways of offering therapeutic options to our patients in a way that causes them less pain and suffering. That originally was sort of laparoscopic surgery in the early days, or keyhole surgery, but now by harnessing computer technology and putting a computer between the surgeon and the patient, we can find increasing ways of being able to do either more advanced therapeutic interventions ranging from cancer surgeries, gastrointestinal disease, all the way up to cardiac surgery, through little holes, through means that get patients out of hospital faster with less pain, back to their normal activities more quickly. We are developing a number of technologies based on computer-assisted surgery. In particular, our outstanding team of engineers here are working on developing robotics technologies. We are Canada's National Centre for Minimally Invasive Robotic Surgery. We were just recently able to announce that we're the National Training Centre for Intuitive Surgical, for example, who market the Da Vinci robot. It's one thing to develop these innovative new technologies, and it's another thing to appreciate the challenge that we have with teaching surgeons how to use them. And the pace of change of new technology is not just rapid, but it's accelerating. And we really have to completely rethink the way we train our surgeons of the future. In the old days, you would come in for 5 years of specialty training and go off to a 30-year practice, occasionally attend an update course to learn what's new. But now that technology is evolving so rapidly and new technologies are coming into the field so quickly, there is a critical need for coming up with new ways of disseminating that technology. And so that's where the role of surgical simulation comes in. So that's the key part of that innovation cycle. It's develop the technology, but then teach people how to use it. We know that medical error is a challenging issue facing worldwide healthcare institutions. So what we have done most recently was made a proposal that we can harness this incredible expertise that we have in haptics engineering, working in collaboration with the engineers at the Robarts Research Institute and their impressive expertise in imaging, working with scientists at the Center for Education Research and Innovation at Schulich, who have expertise in developing education curricula validation studies. We put together a proposal to develop the next generation of computer-based virtual reality simulation devices. And that's really where we've been focusing our energy lately. These are projects that rely on expertise in several areas. So you could say it's not just easier, but collaboration is necessary. I don't think that we could succeed in the types of projects that we're pursuing here if we did not have the ability to bring a wide range of researchers to the table. So the take-home message that I would say is that it is without question that the future of surgery is going to someday be all completely computer-assisted surgery. We are heading towards a future where every doctor-patient interaction is going to have a computer between the two. And the reason why that is so advantageous is that every time we intersperse a computer between the surgeon and the patient, we eliminate human frailty. We eliminate those opportunities for making error. And so whether it be through developing technologies for simulation training or developing technologies for therapeutic intervention, the future of surgery is going to be computer assisted.